Hey friends, it's Susan from legslikemind.com. Today I want to talk a little bit about pain. Did you know that 92% of women who have lipedema report having pain? And over half of them report the pain level as being excruciating, really, really bad. And I wanted to tell you a little bit about what my pain is like. So I am a stage 3 lipedema patient. I've already had 3 surgeries on my legs to remove a lot of fibrosis that was in my calves, especially. Um, but I'm not done having surgeries, and I don't know if I'm going to have more, to tell you the truth. But my pain comes in 2 different ways. One, my calves, basically for me, from my knees down to my ankles, is what hurts, and it hurts at night. Sometimes it can be just like a dull, all over ache, the kind that just makes you like get up and you just want to rub your legs and work them and stuff like that. But sometimes they're screaming in pain. And those are the nights when I'm like, what can I do? Can I go get in the pool? Do I need to use a pump? Do I need to wrap my legs? Whatever, to try and get swelling down or whatever's going on. Sometimes they just hurt because I've been super active during the day and overdid it. And when I'm active, which most days I'm active, but even if I overswim, then I will suffer the consequences with leg pain. And so I have to be really careful about, even though if I'm having like a high energy day, not overdoing it, because if I do overdo it, then I'll have 1 to 2 days where I pay the price and I'm down for the count, right? So the other ways that my legs hurt is in my knee joints. So one of the comorbidities of lipedema, really, really common, is hypermobility. It's called hypermobile Ehlers-Danlos syndrome, and for me, the way that that manifests is primarily in my knee joints. So what you will see with me is that my knee joints hyperextend. So if it's supposed to be straight up and down, it bends backwards a lot like that, right? And it almost like I called it flipping inside out before I knew that that was not something that was normal. And I remember talking to my physical therapist, and I'm like, yeah, when my legs flip inside out when I'm swimming, and she was like, so what? Yeah, that's not normal. What's going on, right? So when they flip inside out, like if I've been even laying flat on the bed and I don't have something underneath my knees to help them stay bent, they hyperextend backwards like that, right? But now that I've had surgeries and it removed some of the fat pads on the inside or medial part of my knees, right? They were actually providing support to my knees, which were all loosey goosey, right? Now they subluxate. And so if my knee is like up and down like this, sometimes I'll be walking and my knee will do this, like that. And then it will get locked that way. And oh my word, does it hurt. Um, and sometimes they lock that way too. It just depends. When it depends. When I'm going downstairs, especially, which I try and avoid now like the plague, they will dislocate or subluxate, and it can cause me a few days of pain, like usually 48 hours. I'm having to use ice, extra elevation, getting in the pool, whatever I can do, because it just hurts so bad. And when your joints are rubbing against each other like that, or they get locked up, you're doing damage. And that's why I need knee replacements, is because my connective tissue has loosened up so much that my joints just touch each other and rub. So anyway, when that happens, there is pain at night, a lot of times at night, but then the next day and the next day after that, I will really be suffering. So for me, I have to use the elevator, even though I physically can get up and down the stairs. That evening, that afternoon, the day after, I pay the price with severe, like 10 out of 10 type knee pain, right? So, yeah, that's the way the pain manifests for me with lipedema. Other people who have a lot more lipedema in their arms than I do report their arms as being really painful. And like, my mom is like, I can't lift my arms over my head long enough to even curl my hair. So it manifests in different ways with different people, but pain is definitely 92% of people with lipedema are reporting it. So it is legit, right? And also, there are a ton of research studies out there that document pain from different pain scales, but it's not just one doctor, it's not one country, it's all over the place where the research has been done to prove research back that the pain in lipedema is for real, right? So, the reason why I'm posting this though is to share with your doctors, to share with your friends, your caregivers, whatever, especially when you feel like you're not being believed that you're fat or your knees are it's hurting, because I want to validate you and legitimize what you're saying to people. And go to PubMed or the Lipedema Foundation website, lipedema.org, and they have blogs and information on the research articles that talk about pain. Okay, so that's it. The other thing I wanted to talk about is how I manage my pain. Obviously, I'm not a doctor. I'm just a patient. Talk with your doctor about it though. So here are some things that I do that help me when I'm struggling with pain, right? One is to make sure to wear your compression, especially on days when you're going to be traveling, when you're going to be doing lots of walking, lots of standing, lots of sitting, right? For me, those are days when I double up on compression, or I make sure and I wear my newest compression, the highest grade compression that I have, right? Some days I even will use a compression wrap on top, like a Velcro wrap, or those Fast and Go bandages that I've been talking about a lot, to give that extra layer of protection on top. Because if you can avoid swelling, then you're going to avoid some pain later. But also the compression actually provides some stability on your legs and your knees and stuff like that too. Just that little extra bit of stability that maybe it will help you stop or maybe eliminate one subluxation, right? Or something like that. So wear your compression. Other things that you can do: elevate your legs whenever you can. Make sure you're wearing good shoes with a sturdy base. And you guys know I'm working on my shoes. They're almost here, I swear. We've got to get them exactly right, though. I have so many pairs of samples here. Make sure you're wearing good shoes with good arch supports, good stable bottoms. No dollar flip-flops. Get rid of those things. Good shoes. I use ice packs, 15 minutes on, 15 minutes off, when I'm having like just a really, really painful night. I also use a cream. Talk to your doctor, right? But it's called Voltaren, and you just get it over the counter, and it's made for arthritis. But like when I get wakened up in the night because my legs or knees are hurting so bad, I will take a dose of that Voltaren and just rub it all over and rub it in. And sometimes that it does go underneath the skin. It can help with some of the pain that's not as deep, and just help you get back to sleep or whatever, right? Obviously, I mean, I have some medications that I take for pain. I don't like anything prescribed that affects the way I think, So I try and stay away from, I don't take like Oxycontin or anything like that. I take something that my doctor gave me, Selexosib or something like that. But I know I used to take Tramadol in the olden days too. But hey, Tylenol, ibuprofen, whatever your doctor says you can take. Don't feel bad if you have to take something for the pain, because it's unreal. Also, there are a few people who are not freaked out by this. I know a lot of ladies who use THC because it does help with pain and swelling. That would be definitely something to talk with your doctor about too. But let's don't go down that rabbit hole. Please don't comment. I'm just telling you, it is definitely something that's available to a lot of people here in the U.S. Also, so ice. Compression, it's just like when you hurt something, rice, you've heard that if you went to first aid training. Rest, ice, compression, elevation. Well, guess what? That kind of stuff helps with lipedema as well. The other thing too is if you use your compression pump, sometimes it can really relieve the pain, right? For me, too, I keep a vibration plate underneath my desk. And when my legs are just like flared up, I've already tried swimming to compress. I've tried all the things. I'll go over here and I'll just put my vibration plate on kind of like the lowest setting and let it just wiggle out some of the pain. And even the movement of wiggling can help too. So anyway, I wanted to talk a little bit about it to make sure that you have some resource out there that you can go to that lets you know it's valid. Your pain is real. I validate you. The research validates you. The Lipedema Foundation has information out there about pain. So stand up for yourself. And patients, refer your caregivers to sites like the Lipedema Foundation. If you feel like your caregivers, your doctors, whatever, don't believe you that you're having pain, just know that there are lots of sources on the internet that are there to support and validate you. All right, friends, I will talk to you later. Have a great day. I will see you later, hopefully with some more juicy information. Bye.